I am going to introduce Dr. Kathy Rospenda, who is a professor of psychology in the Department of Psychiatry. So her office is also in this building on the floors that you probably never stop in, on the 4th floor. And her research centers on occupational stressors, which aligns with my research. So Kathy is one of my mentors, which is why I'm introducing her today. She's really great. I think you'll enjoy her talk. She focuses primarily on occupational stressors and their relationship with mental health, physical health, and drinking behaviors. And she's going to talk today about a longitudinal study that she has of individuals in, do you need to do something up video shot? No. Individuals who were employed at UIC at one time, I believe she'll say more about this, but who she's followed for 25 years to understand their experiences with mental health, physical health, and their drinking behaviors, and how those are affected by workplace harassment earlier on. So without further ado, welcome, Kathy.
Thanks, Tessa. I know our time is limited, so I'll try to go relatively fast. So as Tessa mentioned, I'm going to be talking mostly about recent results we have. We have one article that's been published in BMC Public Health and another that is currently in press in JOEM. So it's mostly those results I'm going to be focusing on today. First, just a brief overview of what I'll be talking about. First, I'll let you know how we defined workplace harassment. I'll give you a bit of background for our research. I'll talk about our study methods and measures relevant to the publications I'll be discussing. And then the results of our studies, talk about some conclusions and future directions, and what might we do about the problem of workplace harassment. So first, what is workplace harassment? How did we define it for this study? It's really an umbrella term that we use to describe any kind of negative interpersonal interactions at work that negatively affect the employment terms, conditions, or decisions that are made about you at work, or that create an intimidating, hostile, or offensive work environment. And there's two separate kinds of harassment that we focused on in our research. One is sexual harassment, and the other one we call generalized harassment, which is really very similar to the concept of workplace bullying. But for workplace bullying, most researchers require that there is like a specific time period over which the experiences occur, and that it continues over a period of time. So we had a more lenient definition of that, where we just had a series of negative experiences, but we didn't require that they happened over a certain period of time. And for sexual harassment, it's an illegal form of gender discrimination. And there are two different kinds. There's hostile environment. So where someone is creating a hostile environment because you're a man or because you're a woman, because of your gender identity, or quid pro quo harassment, which is where someone may offer you something in exchange for something else. So that's like the bad kind of sexual harassment that you hear about, where it's a boss who's, pressuring an employee for dates, and it makes a very uncomfortable situation for the employee. But because it's illegal, most organizations are required to have policies against sexual harassment. And it's very costly to organizations if legal suits go forward. And if you Google sexual harassment, you'll find tons of stories about people who have been taken down by accusations of sexual harassment. Many of the more recent ones are in the entertainment industry and in government and academia. And of course, the Me Too movement has really pushed the issue of sexual harassment back into the spotlight. And generalized harassment, or which is similar to bullying, is harassment that serves to create a hostile working environment, but it's not based on any legally protected social status characteristics like sex or race, or ethnicity, age, disability, or anything else. Research has found that it can be actually more harmful to people than sexual harassment. And a lot of the stories you'll see about workplace bullying, which is similar to our concept of generalized harassment, is when people end up committing suicide because they've been targeted for years, targeted with really serious bullying experiences. So, and again, this also more recent attention has been given to the issue of bullying or hostile or toxic working environments in sports and entertainment recently. And so this is kind of a overall, that gives you a little bit of a background about what is harassment. So why did we end up doing this study on workplace harassment? So it all started back in 1990s. So exactly 32 years ago today, Anita Hill began testifying on Capitol Hill in the Clarence Thomas Anita Hill hearings. Clarence Thomas was a Supreme Court Justice nominee at the time, and Anita Hill was testifying with accusations that he sexually harassed her when she worked for him at the Equal Employment Opportunity Commission. So she went through a series of days of testimony, and yet we know that he still got appointed to the Supreme Court. At the same time, back in the 90s, there was a lot of attention on the issue of medical student abuse and how abusive experiences in medical training were leading to potentially a decline in medical school applicants. There was even a story in the New York Times about it. And in this context, my colleague Judy Richmond was conducting a study of medical trainees. So she took in this what was going on with Anita Hill in terms of sexual harassment and this recent attention to medical student abuse. And she added a measure of 8 different kinds of abusive experiences to her measure of stress that she was using for that study, which was more, she was studying training related stressors. So it was things like having a lot of school deadlines, pressure from taking exams, pressure from, seeing clinical patients, things like that. But she added in these abusive experiences, and she found that 72% of the students reported experiencing at least one of these things during their training. And she also found that these abusive experiences were better predictors than the more typical training related stressors of negative outcomes. So symptoms of depression, people wanting to drink to escape their stress, and problem drinking. And that was for women only, the problem drinking finding. So why might that be? Why might harassment be a better predictor of certain outcomes? Well, we believe that it's a unique occupational stressor. It's something that you don't necessarily go into a job expecting. So you don't expect, you may expect in medical school that you're going to have a lot of, work deadlines are going to be taking in a lot of information. There's a lot of time pressure, but you don't necessarily expect that you're going to be abused or harassed in your training. And this is true of other work settings as well. And also harassment there tends to be, maybe 1 or 2 targets of harassment in a workplace rather than everyone experiencing it. So if you're being targeted and other people aren't, you may be more likely to feel like something is wrong with you, that you may be blaming yourself or feel that you're inadequate in some way. It's also an unpredictable and uncontrollable experience, which can lead to feelings of powerlessness and fear. This is especially true of, the more bullying or generalized harassment experiences, which aren't protected by law. So there's really no legal recourse for complaining about these experiences. There's also multiple potential losses associated with being exposed to these. So you may, if you're a worker, you may feel that you may lose your job. You may worry about not getting promotions, being isolated from your coworkers. So it can be very stressful and hypothetically more distressing than more typical job stressors like job demands or job control, which are really more tied to characteristics of the job itself rather than harassment, which is something beyond characteristics of the job itself. So what Judy Rich and my colleague proposed at the time was that she wanted to do a study of a broader section of workers. So she got funding from the National Institute of Alcohol Abuse and Alcoholism to look at how experiences of workplace harassment might impact drinking behavior. And she, building on that study, which occurred between the years of 1995 and 2011, we got a follow-up, funding for a follow-up of this same sample in 2019, and we're in the process of finishing up our data collection and publishing papers from that study. The theoretical orientation that we're using is based on the stress process, and that is something that was proposed by Leonard Perlin. He's a sociologist. And this is a very simplified version of the stress process model. And we, in the stress process model, we have environmental demands like job stressors, including workplace harassment. And you can you see? Oh, you can, okay. Which then lead to stress reactions, such as anxiety, low mood, cognition, such as rumination, and potentially behavioral reactions. And ultimately, if these stress reactions go on long enough, it can lead to strain or illness. So major depressive disorder, anxiety disorder, or substance misuse or substance use disorder. And as part of this stress process, there are also modifiers, which would be things like resources that people have to counteract the negative effects of stress. So social support, coping skills, expectancies about whether they think that alcohol would actually reduce their tension or not, and also other variables like gender, race and ethnicity, et cetera. So I won't really be talking about this component of the model today. I'll mostly be focusing on just the job stressor and stress relationship, and we'll get a little bit into the strain and illness when I talk about the physical health outcomes. And so theories about why stressors like work stressors may lead to drinking is that people may use alcohol to cope with tension and the fear response that is triggered by exposure to stressors. So it's called the tension reduction model. People drink to reduce stress, or the self-medication hypothesis, which is basically the same thing. So the methods for our study, these were all employees of an urban Midwestern university. Tessa kind of blew it, and not blew it, but like let the genie out of the bag and let you know that it was UIC employees that were originally sampled from the payroll database in 1996. And we wanted to make sure that we had a variety of occupational groups represented. So we sampled from faculty, student workers, so that would be like medical residents, GAs, RAs, TAs, service and maintenance workers, and clerical and administrative workers. And we wanted to make sure we had a balance of women and men. So we selected out a little over 2,400 men and women overall from these four groups. Before we did the survey, we conducted interviews and focus groups with people. And that was because there had not been a validated measure of generalized harassment that had been created that was typically in use at the time. So we created our own measure based on the interviews and focus groups. Then we did a male survey at 8 points in time over a period of 10 years, and that was between 1996 and 2007. Some of those time points we asked people to remember multiple years worth of data on harassment. So we have 10 time points of harassment data, even though it was only 8 waves of data collection. I hope that makes sense. But and we had about 2,500 respondents at time 1, which is around a 52% response rate. We did then more recently, we did 2 waves of mail or web survey follow-up in 2020, which was really bad timing because it was the pandemic. And then in 2021, and we had 921 responses at wave 9 in 2020, which is actually more than we predicted, which is great. Our measures of workplace harassment. So we use the sexual experiences questionnaire, which is the most widely used measure of sexual harassment that is out there, and our measure of generalized workplace harassment. They included various subtypes of harassment within each measure. And these are behavioral, these are measures of behavioral experiences. So there are different ways of measuring harassment. And for these, you have this series of items, and people say yes, no, or whatever to their to each of the items. So they might be asked if they were treated differently because of gender, repeated requests for dates, promise of promotion in exchange for sexual contact. So there are 19 of these items for sexual harassment, and we sum up the total, and then we decide based on that, do we count people as being sexually harassed or not? And we counted people if they experienced at least one item more than one time. And the same thing for generalized workplace harassment. And that's a different way of measuring harassment than is typically used. In a lot of research, people just ask in the past 12 months or past 24 months, have you been harassed or bullied? And people say yes or no. So because of these different ways of measuring harassment, when you look at prevalence of harassment, you get very wide differences in what the prevalence looks like. So this is all the data in this slide is from large scale studies and one meta-analysis. And you see the rates are just all over the place, but you can see in general that when you ask people to just say, have they been harassed? The prevalence is much lower than when you count up the number of behavioral experiences that are considered part of the construct of harassment. So our data, when you look across and we only included a measure of harassment at waves 1 through 7, so we didn't have it at wave 8. So when you look at our prevalence rates across those time points, you see the numbers in red here, and they're all within they're generally consistent with other reported prevalence rates. There's nothing that stands out as being like, whoa, that's really odd or out there. And another thing I guess I want to note is that in our study, we actually did not find a gender difference in the prevalence of sexual harassment. Part of that is likely because most of the research in the past had been done excluding men. So it was just assumed that men had lower rates of sexual harassment. And generally, though, in other research, like we did a national study and we did find that women have slightly higher prevalence, and also women are more likely to label their experiences as sexually harassing. So men might be experiencing the same level of experiences, but it's not necessarily as stressful to them. But as our results will show, even if they're not labeling their experiences as harassment, they're still experiencing negative outcomes. So because we had these multiple waves of data, we wanted to figure out a way to capture the patterning of harassment over time. So we used latent class growth mixture modeling to see if there were different classes of harassment that would reflect different patterns of harassment over time. And what we found for both generalized harassment and sexual harassment were two classes. So this top line here shows a group or a class that has overall higher average levels of harassment over time compared to an infrequent group that has much lower levels of harassment over time, but not necessarily zero harassment over time. And that was true for both types of harassment. And when you look at how many people were classified into each of those classes, about a third of the sample for both generalized harassment and sexual harassment were categorized as having chronic harassment over time. And when you look at gender differences, women were more likely than men to have chronic harassment, but only for generalized harassment. Women and men had very similar levels of prevalence of chronic harassment for sexual harassment. So then we use these classes in our future analyses to look at outcomes. For our alcohol misuse measures, we used, for the studies I'll be talking about today, we have a measure of binge drinking. So that's in the past 12 months. Normally over most of our waves of data, we ask in the past 12 months, how often did you have 6 or more drinks of alcohol? And then we describe what that means. This reflects a difference in how binge drinking used to be defined back in the 90s compared to how it is now. So now binge drinking is considered to be 5 or more drinks for men, or 4 or more drinks at one setting for women. But because we wanted to be able to compare our measures over time, we stuck with this 6 or more drinks measure. And then we also asked them about how often in the past 12 months they drank enough to feel drunk. The one caveat about this is because we did wave 9 during COVID, and we knew due to all the reports that were coming out that alcohol was increasing during COVID. So we knew that we didn't want our findings or our measures of alcohol to be biased by what was happening during COVID. So we asked people about 2019, what happened, how was their drinking in 2019 rather than 2020? Sure. Yeah. Usually it's 30 days.
Oh, okay.
But we did also ask about 30 days, but because we hadn't asked about 30 days in the prior study, we ended up not using it for these analyses just because we couldn't compare it directly over time. So yeah, a lot of there's good things about longitudinal research and bad things about longitudinal research. For our mental health measures, we looked at symptoms of depression in the past 7 days using 7 items from the Center for Epidemiological Studies Depression Scale, and symptoms of anxiety from the profile of mood states. And just this slide just shows you that it's pretty well decided that harassment has negative effects on well-being and mental health. But most of the studies that are typically done have been a much shorter time frame in terms of follow-up. So either it's cross-sectional research or it's, maybe a year of follow-up, but generally you don't get longitudinal research. In the past, there hadn't been longitudinal research on harassment. So now I'm going to tell you about the findings that we have from our study that was published in BMC Public Health recently, looking at the association of prior exposure, so the pattern of prior exposure to workplace harassment over the 10-year period of our prior study with recent mental health and alcohol misuse. So the strengths of this is that it's a much longer time period of follow-up compared to other studies, which the most that other people had followed up in the past had been 13 years. And maybe, there was one other 10-year study, but that was us. So, and most other studies they've also been conducted outside the United States. And we also included the role of income and current non-work related stressors in our analyses, which is something that most other harassment research doesn't do. So this is our structural equation model, the results for alcohol misuse. So the strongest predictor of alcohol misuse, more recent alcohol misuse, was past alcohol misuse. But we see a positive effect for generalized harassment class. So if you experienced harassment and you were chronically exposed to it over that prior 10 years, you're more likely to currently be exhibiting alcohol misuse. We also found, we didn't predict this, but we found that if you were exposed to chronic harassment, your current income was likely to be lower. And this is also something we didn't expect. We just really wanted to control for other non-work stressors. So this stress index here was a measure, it was a composite measure of life stressors. So things like having people close to you die in the past year, or having like legal troubles, and also COVID-related stressors, and also macro-related stressors like going through a national like a natural disaster, or having some other kind of stressful non-work-related life experience. So this stress index, what we found was that if you were exposed to chronic generalized harassment previously, you were more likely to have high levels of current stress, which kind of fits with the Leonard Perlin also proposed, in addition to his stress process model, he also proposed that certain stressors may lead to a proliferation of other stressors. And I think that's what we're seeing here. And our results for psychological distress are pretty similar. Oh, and I also should say that the results for alcohol were very similar for sexual harassment. I just wanted to give you an example of one analysis we did with generalized and one with sexual harassment. So these are the results for psychological distress. recent psychological distress. Again, past psychological distress at wave 1 was the strongest predictor of current distress. We also see a weak but positive association between being in the chronic sexual harassment class previously and experiencing more distress currently. And here, an interesting finding is that we also see that being in the sexual harassment chronic class is associated with higher levels of current stress, and there's an indirect effect through current stressors on psychological distress for sexual harassment class. And this is a significant effect. So you experience chronic sexual harassment in the past, you experience more stress now, and you're more likely to have psychological distress currently. So this kind of leads us to wanting to revise our original theoretical orientation to add in this arrow here, so that past job stressors, and here we're looking mostly at sexual harassment, lead to possibly proliferation of other life stressors, and that can impact this whole stress process. And now this is, I'm going to be talking about the other paper that is currently in press. So for this paper, we measured, added a measure of health conditions. They were items drawn from the 2017 National Health Interview Survey. We measured these various physical health conditions, and we also assessed migraine symptoms in the past 3 months. So for each of these, we asked for had they ever been diagnosed and the age at first diagnosis. But for migraine symptoms, we neglected to ask the age at first diagnosis, unfortunately. So here we're looking at the association of prior exposure to workplace harassment with the onset of physical health conditions over the time period of the whole time period of the study. We used a propensity score matching approach. So we created groups that were matched by gender and race and ethnicity and age, who either had exposure to chronic exposure to sexual or non-sexual harassment and or not. And I'll also talk a little about the sensitivity of analysis. So what we found was that sexual harassment, chronic exposure to sexual harassment over the prior study period was associated with significantly higher odds of having a new diagnosis of arthritis or rheumatic condition over the study period, or migraine. And generalized harassment, chronic generalized harassment, was associated with increased odds of coronary heart disease. So when this is what we originally submitted as our paper, and then the reviewers came back and said, well, how do we know that the diagnosis occurred, following the exposure? So then we took people in the chronic harassment groups who were exposed to harassment at time 1, and we looked at that smaller group of people and looked at their new diagnosis, waves 2 through waves 9. So in this case, we know that the exposure we're looking at occurred before the new diagnosis. And it kind of wiped out, unfortunately, it wiped out our results for coronary heart disease and generalized harassment and migraine. But we have an even stronger effect here for sexual harassment exposure on arthritis and rheumatic conditions. And we see that if our sample had been larger, this effect would have been significant for generalized harassment and coronary heart disease, and also possibly cancer for generalized harassment. Oh my God, yeah. Well, I didn't do the analysis, so. So the lead author on the study was actually a medical student. So we mentored him through this paper, and he came up with all these reasons of why and how exposure to harassment might be impacting these physical health outcomes. So for people who are more medically inclined, Susan and others, so for migraine, we think that maybe harassment, it affects the corticotropin releasing factor, which regulates activity of the HPA axis, which can trigger modulation of serotonin receptors and contribute to vasodilation ultimately, which can, I guess, be associated with migraine. For arthritic and rheumatic conditions, there's a neuroendocrine cascade that might happen that can lead to ultimately autoimmune disease. For coronary heart disease, there's something called an acute phase response, which may perpetuate chronic inflammatory processes such as hardening of the arteries. And also harassment may impact mental health. We know it does, which then can lead to reduced ability to achieve health conscious choices. So, you might be so stressed out that you're not able to take care of yourself. You don't really care about your diet as much. You're eating snack foods. You're self-medicating with food or with alcohol. Or harassment may lead to poor sleep. And there are actually a lot of studies out there that show that harassment is associated with poor sleep. And we know that poor sleep is associated with a lot of health issues, including hypertension and diabetes and heart attacks. So these are some possible mechanisms that may explain the relationship, but they haven't been tested yet. So in conclusion, we see that workplace harassment is an occupational health and safety issue that has potentially career spanning health related impacts for people. We really need a better surveillance of this issue using a consistent measurement strategy. I was actually part of a group that met in Washington, D.C. 2 years ago about sexual harassment and, the problem of sexual harassment, how prevalent is it, and what are the costs to society. And it was a bunch of sexual harassment researchers that came, and we all agreed that the problem is that we don't have a consistent measurement strategy. That's one problem. And we don't have enough research in this area on a large scale. So we have a lot of these little piecemeal studies on, very small samples or very specific samples, but nothing large and representative, with the exception of one study that I did back in 2009 that was a national phone survey, but it did not include the entire measure of sexual harassment because we were worried about people not staying on the phone for a long time. So other research that we need is we need larger, more representative samples, as I mentioned. We need to study the mechanisms of effects, like why does harassment have effects on mental health and alcohol use? We need to study these mediating factors. So, what kinds of distress, what kinds of cognitions are associated with poor mental health or increased alcohol use? What about susceptibility to other stressors? So all of these could potentially be intervention targets if we can identify them. And we need to study what mechanisms lead to long-term susceptibility to disease. I mentioned that already. So what other stressors might harassment increase the likelihood of being exposed to? That whole negative association between harassment and income makes me think that one of the stressors might be a inability to progress in your job. So, or job loss, like you're having to change jobs to get away from harassment. So you're not, your career progression is maybe chopped up rather than progressing smoothly. We want to study the impact on mortality, and we actually just submitted the data to the National Death Index to get the death information for people in our study. So we will be looking at mortality, the effects of this prior exposure on mortality over time. And we need to learn more about the societal costs of harassment and potentially to help us get better policies and stronger laws. And we also need to develop and test interventions. There really are not many out there. There are policies that most organizations have for sexual harassment to prevent it, but and everyone has to do the sexual harassment training, but there has been so little literature on whether sexual harassment training does anything at all. There really has been, I don't think there's been a single validation or an assessment study of the effectiveness of that as an intervention. So what can be done about this problem of harassment in the workplace? And I took some of these key recommendations from the National Academies of Sciences and Engineering and Medicine. They did a consensus study report of sexual harassment of women in academia in the STEM field, but I think a lot of these recommendations are relevant to other kinds of harassment as well. So addressing common forms of harassment, so that would be gender harassment for sexual harassment. And that would be things like, for generalized harassment, things like just like an uncivil work culture. So having someone yell at you or exclude you from meetings. Those are some of the most common kinds of generalized harassment that we see. And moving beyond legal compliance, like this whole focus on training and compliance for sexual harassment, to address actual culture and climate of organizations. So we need to create diverse and inclusive and respectful environments. And this applies to, this would help reduce generalized harassment or bullying as well. We need to have clear policies and procedures and consequences, and also non-formal means of reporting. A lot of people are scared away from reporting sexual harassment or bullying. For bullying or generalized harassment, there are a lot of places have no policy at all. I've been trying to push UIC to create an anti-bullying policy, and they were on the verge of doing it, and then the board said no, they weren't going to do it. So but a lot of other universities do have anti-bullying policies. So they do have it for students, but they don't have it for faculty and staff and as like a general organizational policy. There needs to be a lot more support provided for targets so that if they do report, they're not faced with retaliation. And we need leaders who are trained on how to recognize harassment and how to create inclusive environments to prevent harassment from occurring. We need to measure harassment, and so we know that if what we're doing is actually reducing it. We need to incentivize change. So things like for sexual harassment in the medical field, so hospital accreditation, any kind of accreditation that occurs for like hospitals or academic programs, we can incentivize change by making sure that people have policies before they're able to get accredited, or that they are doing something to prevent harassment. And my own suggestions are before we get all this, we can do the best we can to create diverse and inclusive and respectful microclimates in our labs or in our classrooms, in our workplaces. So, and that's pretty easy to do, really. And we can also advocate for law to prohibit generalized harassment or workplace bullying. And this is the Healthy Workplace Bill, which I have David Yamada and Gary Namey. They are two people who have been pushing for this Healthy Workplace Bill for, I don't know, like 20 years at this point. It's been introduced in 32 states. It was actually introduced in Illinois, but it was way back in 2009. It did pass the Senate, but it was never voted on in the House, unfortunately. So this graphic shows all the states where it's been introduced. There are 2 states, California and Utah. They have training only mandates for either all employees in California or for state employees only. So that means that they have to have some kind of anti-bullying training, which is not really all that much. And the bill is currently under consideration in 3 states, Massachusetts, New York, and West Virginia. So if you're interested in becoming an advocate, you can go to the Healthy Workplace Bill page and see what they have to say about what you can do. These are just the acknowledgements of our research support. The data was collected by the Survey Research Lab at UIC, which no longer exists, unfortunately, and the University of Chicago Survey Lab. And NIH had nothing to do with the contents of this talk or any of our research. And here is our project team. So let me know if you have any questions.
Kathy and Dolores, I had a very great presentation. I had a question, and
So,
the parent,
in the survey, were there any distinctions made between whether their experience of harassment was from a peer or from a supervisor?
That's a really good question. And we did have that information in the first like 2 years of the study. It ended up being so complex because a lot of times it would be, you know, both a peer and you know, a boss or a client. And so we ended up not really knowing what to do with that information. So we stopped including it, but that is a really good question. And it is different, I think. Like when it's a boss that's harassing you, it's a lot more serious usually. Yeah.
I had another question.
Okay. Susan?
Thank you so much. It was so interesting. I feel like I've known you a long time and I don't think I've ever heard you present one, so.
Oh, wow.
So this men courting harassment is really interesting and we don't talk about it nearly enough. And I'm wondering if there's, I'm just interested in what that's about. Is it same-sex harassment? Is it opposite sex harassment? I know it certainly feels like the pendulum is swung and women can get away with doing some harassing behavior to men that wouldn't work the other way around until the pendulum kind of swings back into the middle. So what did you get detail on what's going on?
Well, we did look at by occupational group, the prevalence of harassment, and we found that the prevalence for men was highest in the clerical and administrative group, and that was also the group where it was mostly women. So, and the women, it was women faculty who had the highest levels of harassment overall. And at the time, it was, I think it still is, you know, faculty women are outnumbered by faculty men, I think still. So we think at least part of it is this opposite gender workplace kind of thing, where if the men or women are a minority in the workplace, then they're more likely to be targeted. And that's consistent with other research that's been done on women, where, you know, any kind of occupation where women are in the minority tends to be the ones where they get the most sexual harassment. So yeah, but we don't really know all that much about the harassment of men. There has been a lot of research on like men on oil rigs and in very manly kinds of jobs like that. And there is a lot of same sex sexual harassment that happens in those settings too. So, but yeah, more research is needed.
Yeah.
hi, I had a
Okay.
question.
For the, I think in particularly for service and maintenance and clerical and administrative, were those all within the educational side of UIC, or was it also on the healthcare side in the hospital? And was there a distinction in the data set in terms of whether they came from one or the other?
We did not have a distinction on that, but I believe that it was for clerical and administrative, I believe that was only the university. And I think service and maintenance was the same. I'm pretty sure it didn't include the hospital.
Oh, did not include.
I don't think so. I don't think so, but that's a good question. I'll see if I can, that's something I will write down for future study.
Are you hear me now?
Anything else?
One thing that I really, unless you've done psychosocial mental health research, you don't appreciate necessarily about this, but you presented really well, just because there's lots of students around, is the fact that you weren't really asking somebody like, have you been harassed with one or two items? You're really asking about sort of the symptomology or experiences or like those domains are really in order to get to what harassment looks like, which makes it a little bit more powerful research. You can see the same thing in sort of discrimination research too. You can't just say, you just don't always know what's happening to you. You know, you don't feel good. You're having these experiences, you just don't know that they would be defined by others as harassment. And so I found that really nice, sort of here's the integrating that. It's really helpful. So that's the importance of survey research. It's much more complex than a one item question. It's trying, depending on what you're trying to study and do you feel like people were more likely to respond because you asked about multiple items of experience in an anonymous way than rather than being bullied by my supervisor?
Yeah, and I think that's especially true for men who might be reluctant to admit to, especially sexual harassment at the time. You know, when we first started the study, I think it might be different now, but I think it is helpful to know, or I don't know, it could also, I also wondered if, and we haven't looked at this, whether just by being asked these questions over and over, if they started to realize that they might have been harassed, you know, like if their opinion about what was harassment changed over time, but I'm not sure if we can get to that.
And have you done any sort of national work about how many universities have or workplaces have sort of like on the policy side of things for ombudsman or other places where people can go?
I started looking into at least which universities had anti-bullying policies for employees, and there's at least like 9 or 10 out there, but I didn't look at, you know, what that looked like. Like, did they have ombuds people or how that was factored into their structure, their you know, the academic structure.
Did you look at whether there was like justice or remediation for harassment?
That would have been super great to look at, but we didn't. We looked at whether people use services. So we did look at, you know, like, did they report it to somebody at the university? Did they go to the EEOC or anything like that? Or did they go to their doctor? But I think we might have asked about whether they were satisfied at some point, but that's buried somewhere in the data, but that we might be able to look at that. But it'd be like a long time ago at this point. That's a good question. Anything else?
So I became the solution for the entire implementation, but I wasn't thinking of what can you do?
That's a really good question too. You know, a lot of people say mindfulness, you know, mindfulness solves everything, or exercise, or, you know, try to elicit social support. But ultimately, if you're really seriously being harassed so, I mean, one thing you can do as an individual, if you're being harassed, is talk to human resources, but oftentimes human resources wants to protect the organization. So a lot of times that's an unsatisfying solution for people. You can go through the whole stress of, you know, filing a lawsuit if you're being sexually harassed or like racially harassed or harassed for any legally protected characteristic. But oftentimes people don't want to go through that. But just in terms of dealing with the stress of it, you know, any kind of healthy way that people have, like exercise or, you know, meditation or doing something fun that you like to do outside of work, that's all well and good, but it often doesn't go far enough. And a lot of times people will have to switch jobs to get out of the situation. So, unfortunately.
Question from viewers. Something from illegal learning and black communities with severe bullying.
Oof, that is a really good question. I mean, I think just by starting to have anti-bullying policies be more common, that's one thing that can be helpful. But given that race and ethnicity is a legally protected characteristic, there are options for you know, complaining legally, you know, going through the legal system to file complaints about discrimination. Because at that point, if you're being harassed and discriminated against or targeted because of your race and ethnicity, then you have a legal case for trying to address that issue, even though that's an extremely stressful thing to do. Which gets back to my hopefully call for the creation of better leadership in organizations that's more sensitive to issues of diversity and that can create climates of inclusion for people. I know it's not a satisfying answer. I'm sorry. That's a really big question. And I mean, the fact that this has been going on for so many years and it's still going on and we do have sexual harassment law is like the most depressing thing to me. So. Yes. The. Are. There is, are you talking about the Equal Employment Opportunity Commission, the federal? Oh, like a access and equity office. Yeah, people have tried going to that office for problems with bullying. But without a policy in place, like they often, they ask them to maybe do mediation where they have someone come in and try to have people talk it out, but that's often not very helpful. But that's a great question. And this is why I think we need more policies, anti-bullying policies.
Thank you so much. I hope you can stick
Thank
around if people have individual questions, but thank you very much.
Thank Thank you for having me. Oh, thank you.